offer you the least invasive, most cost-effective way of getting pregnant first. And of course, we want to match your expectations so that we can move forward just in case the initial approach doesn't work. Next slide. So, primary considerations that we usually ask in the clinic is, how many years has the couple been trying to conceive? Has it just been a year, 2 years? Has it been 10 years or 15 years? Because definitely, we want to get you pregnant at the soonest possible time, right? And then the next is, what investigations have been previously done? We try to ask a chronological order of what has been investigated so far so that we don't repeat those tests all over again, right? And the last one is, what treatment options have been performed? If, like, let's say you've been to another doctor and they've done timed intercourse and it didn't work, probably we can move on to the next option. Okay, next slide, please. And the most important thing is you need to find yourself a good fertility doctor. In the Philippines, we are specially trained. Basically, the three of us here are obstetricians and gynecologists, but we did special training for fertility. So in the Philippines, we have a lot of fertility doctors all the way up north, all the way down south to Zamboanga. And the most important thing is for you to be evaluated completely and for you to be treated adequately, make sure that you find your way to a fertility doctor. Next slide. Here in the Philippines, you don't need to go outside the country, okay, to try to find a fertility doctor or to try to find yourself treatment. A lot of the doctors, a lot of the fertility doctors that you'll be meeting in your course are actually trained abroad. So whatever's being done, probably in Singapore, Gia and myself can do it because we were both trained in Singapore as well. And here in the Philippines, there are a lot of IVF centers already. It's just that we cannot be completely open about it. Okay, and like in other countries, that you know that there's a fertility center wherever, because they can advertise. Here in the Philippines, it's mostly by word of mouth. Okay, so we have fertility centers as far down south as Davao, in IVF Davao. We have some fertility centers here in Metro Manila. We have Center for Reproductive Medicine in Ortigas, where our next speaker would be part of, Dr. Almeida's part of CRM. There's also Center for Advanced Reproductive Medicine and Fertility, or CARMI, in St. Luke's Global. There's Cato Reproductive Biotech Center in Enterprise in Makati. And there's Repro Optima in Cebu. And Gia and I are in Victory ART in Medical Plaza, Makati. Next.